Hi, my name is Dr. Lucy Meier from Third Coast Foot and Ankle, and I am going to answer a very common question, which is how do I get rid of my heel pain as fast as possible? So we help a lot of people with plantar fasciitis at our office, and of course everybody wants to get rid of it as fast as possible. And there's two answers to this question. Number one is we want to make sure that the injury is actually healing, and that is different than the pain going away. And let me explain that in a little bit more detail. Now, when we have an injury, our body goes through an inflammatory process, which essentially recruits cells to allow that injury to heal. Then it repairs it, and then it goes on to recover. And that entire phase can sometimes take up to a year, to be completely honest. But the part that we always focus on is the part that causes pain, which is usually that period within the first 3 months. Specifically, the first couple weeks of the injury tend to be the most painful as your body is quickly recruiting and trying to repair the injury to give it some stability. And so some of the problem with getting rid of pain is just letting our body get through that process. And so there are some situations where we can actually speed that process up. We like to use something called a level 4 laser in our office, which essentially just puts your cells on overdrive. So it does something by increasing ADP, which is really a fancy process. To simplify it, it's increasing the metabolism of your cells. So we're trying to ask your body to work a little bit harder and a little bit faster during that time of injury. And we focus that treatment, obviously, where you have that injury. So it can be effective at decreasing that time it takes to see the decrease in pain. Now, the second part of this is that inflammation and in these processes cause pain. And so can we decrease the pain while still allowing these cells to do their job? And the answer is yes. Now, depending on the type of injury, there are certain things that we can or cannot do. When we're dealing with plantar fasciitis, we will oftentimes use a cortisone injection. Now, cortisone is an anti-inflammatory, and it does typically, not for everybody, but for most people, have a very dramatic effect at bringing the pain level down. It does not cure plantar fasciitis, and it does not make plantar fasciitis go away, but it does bring that pain level down. We always have to be careful when we're using a treatment like this that we're not masking the injury, and then we are not also doing the appropriate steps to make sure that that injury continues to heal. So cortisone can be really effective if we're concerned about the level of pain that we are having. If it's necessary, we can do something like that. Now, there's also other medications that we can use, right? We're all familiar that if we have a headache, we'll take ibuprofen or Tylenol, and that helps take the pain away. The same is true with plantar fasciitis or heel pain, though sometimes the amount of pain that is relieved with these types of medications are minimal or not sustainable. And so if you're having a hard time managing that pain and you want things to be going faster for you, we can help. But I also want to make sure that we are helping you with your pain but also helping you recover and repair this injury so it does not become a chronic pain issue. We have multiple different levels of treatment plans for our plantar fasciitis patients that, depending on where you are on this healing scale, there are different treatments that are more effective, once again, to both get you better, but to also minimize your pain. So if this was extremely helpful for you, please like the video. That helps us incredibly. And if you have any questions, please call our office. Once again, I am Dr. Lucy Meier from Third Coast Foot and Ankle.